Hi, I'm Paul Fletcher. I'm the admissions tutor and senior lecturer for the Podiatry degree programme. I'm here in the clinic at the moment. I normally like to get you down here and show you around, but just at the moment, because of COVID regulations, we're not able to do that. I'm recording this for the open day at the university, so that you can get some idea of our exciting podiatry programme that we've got here. I'm down in the clinic and we're going to go and have a look at some of the rooms in a moment, and I'll explain some of the more exciting parts of the programme when you'll be down here. It's a blend of theory and practice, so it's not just sitting in a classroom and being talked at, it's very interactive. We employ active blended learning, which is really helpful at this time at this university, because our online resources are really good. So we do send you material anyway to be working on, so that the interactive parts of the programme are much more hands-on. Hi, we're in the podiatry clinic reception area at the moment. As you can see, we're getting all set up for social distancing so that the clinic can begin operating again. We're just starting to have patients coming in and being seen by some of our graduates who work here, making sure that all the patients are seen when the students aren't around. Hopefully soon as well we'll be doing social distance teaching for the clinical elements of the module down here at the clinic, as long as all safety elements are observed. And it may be possible that you could probably visit the clinic here as well and have a tour and maybe see some of the things in action once all the safety regulations are in place. So here we are in the clinical facility. This is the central sterilisation area. The students will be involved in sterilising and preparing their own instruments. This is an area where they'll come as well. There are computers here where we can actually access information about patients and those kind of things. Each student will get their own individual clinic area, and the members of staff will supervise probably about 4 students each, a ratio of 1 to 4, just depending on the level that the student's at. The clinics here actually link directly to the modules that we're teaching, so we have clinics in orthopaedics, in podiatric medicine, the at-risk limb, sports and paediatrics clinics as well, so that the patients can actually come and be organised according to the level that the student's at. So that links theory to practice particularly well. So if we move in and have a look in and around the clinic area, you can see that the clinic cubicles are pretty sparse. There's not very much in them, but the students get exactly what they need for each individual patient, and tailor the equipment that's got for those. So the scanners, those kind of things that the student can get, and there are different kinds of instruments for different procedures, and depending on whether it's a sports or an orthopaedic clinic, you get different kinds of assessment. Hi, here we are in the orthotics lab. This is where the students actually make orthotics, and they will take prescriptions from patients. Some of them from, this is a negative cast which they've taken from a patient in the clinic, and then they transform these into what we call a positive cast, and these are then used and manipulated so that we can make different kinds of orthotics, casted devices which alter foot function and those kind of things. We also have a system which is capable of making orthotics immediately for people like sports, people who might need something to take away with them on the day. This system is a little bit more expensive than traditional manufacturing. It's actually a commercial lab, this, so we produce orthotics for private practitioners as well as the students' own work, which they're doing in the university. It's linked very much to the anatomy and the way that the body works. So the anatomy that the students learn in the first year, it's very exciting here in that the students get to go and do a 10-week cadaveric dissection program in conjunction with Leicester Medical School, and I get the privilege of taking them down there too, and they get a limb between probably about 4 or 5 students to dissect, and there's nothing like the sort of practical experience of actually exploring a real human limb as you're learning the In addition to the general clinic area, we've actually got some specialist rooms as well, which we're going to have a look at now. This is where the students will do their minor surgery. They'll learn how to do nail ablations and those kind of things under local anaesthetics. And they also get access to some antibiotics as well for assisting with these things. If you're really interested in this surgical side, part of the programme is going to see podiatric surgery, and if it really floats your boat and excites you, that's the kind of thing that you can specialise in later. So this room is where we've got all the resuscitation equipment, the anaesthetics and those kind of things. They're also useful little rooms if you want to see a patient a little bit more privately, maybe if they've got specific learning difficulties and they're not suited to the general environment. This room is a really useful room, not just for teaching. We've got various projection facilities in here as well, but we've got lots of diagnostic equipment. So we've got the fluoroscopy unit, which is called a mini C-arm because of the shape of it. We use that for x-rays for when we're doing intra-articular injections. We've also got ultrasonic scanners. These are used for diagnosing soft tissue injuries and those kind of things. This particular piece of kit's rather expensive because it does vascular assessments as well, so it's got a colour Doppler on it. And it's really useful for helping to teach anatomy as well, because you can actually see the structures and those kind of things. So maybe when we've done a lecture, we'll come in and scan each other and see some of the muscles and the blood vessels working and those kind of things. So we're really lucky to be well supported by the university to have this clinical facility. We see somewhere in the region of about 500 patients a week in various different clinics when it's fully operational. We have no shortage of patients, so the students get lots of experience of different kinds of surgery, different kinds of treatments.
Hi, my name is Ekta and I just finished off my first year of podiatry at the University of Northampton. I've actually had a really great first year because the staff is incredibly supportive. They do want to see you succeed. They do push you to be a better student, and that definitely shows with their hands-on approach in teaching. And in the first year, you'll cover dissections, biomechanical assessments, being in clinics with patients. So just real life skills you get taught immediately right off the bat, and you get to work on it in your the rest of your years that you're studying podiatry. Also, the campus itself is very green. It's very focused around reducing the carbon footprint, and that definitely shows with the new waterside campus that we have. So ultimately, I think podiatry and podiatry at the University of Northampton are fantastic choices.
Hopefully you've enjoyed this mini tour of the clinic and a little short explanation of what it's like being on the podiatry programme. I am available at open days and usually there if you've got any questions about any of this or how it would all work for you. My email address is paul.fletcher@northampton.ac.uk and I'm more than happy to take queries